is very important. That is on basic life support. And why we people want to know why it is important. I'm going to tell few points why it is important, what is the benefit behind it. Every citizen of Bharat must be trained in basic life support. This is the gift of life. What is the importance of BLS? It saves life. Like BLS training equips individual with the skills to respond to cardiac emergency. And it should be intervened timely. Then it has importance. If it is intervened timely, it can give significantly improve the survival rates. What are the benefit of BLS training? When there is according to Indian Heart Journal, nearly over 4 to 5 million deaths annually worldwide is because of sudden cardiac arrest. And 7 lakh plus people die because of this sudden cardiac arrest each year. So that you have seen, that's a big data. And cardiac arrest can strike anyone, anywhere, and it increases the confidence. How it will increase the confidence? If you have done the BLS training, that will boost your confidence, that will help it during the emergencies, and this will improve the response, and it will, how by training the individuals, and it can provide effective care during cardiac emergencies. If we are going to learn about BLS, that the whole community will get impact, and it can lead to more lives saved. Every minute counts. When there is a brain death starts in 4 to 6 minutes after the cardiac arrest without CPR. If the survival rates decrease by 7 to 10% for every minute delay, if we know how to do it and we are there, then that we can help. Every minute, every second matters. And next person nearby is the only hope. Nearly 70% of the cardiac arrests occur outside hospital, at home, near school, colleges, workplace, while traveling. That we know. And now I'm going to start regarding the what is the basic life support. These are the immediate emergency procedure which include cardiopulmonary resuscitation to maintain the vital functions and circulate the oxygenated blood in cases of cardiac or respiratory arrest until the professional medical help arrives. It focuses on maintaining an airway, support the breathing and circulation to prevent the death and improve outcome for a person experiencing a life-threatening emergency. What are the three major steps of the basic life support? Immediate recognition of the cardiac arrest and the activation of the emergency medical team services. Early cardiopulmonary resuscitation, then rapid defibrillation. This is called the chain of the survival. We should act. Firstly, immediate we should recognize, then the CPR, and this is a defibrillation. Before starting all this thing, we have four things we have to see. Either the wherever we are doing the CPR, that scene is safe or not. Then we have to see the response. Then we have to call emergency call, and we have to check the breathing and the pulse. We'll go one by one. First, this is the scene safety. Whenever you see somebody is lying on the road traffic accident, then you have first think, you think, will it be safe for me to go near her? If there is any fire incident is going on, then you have to think again, will it safe for me to go inside? Or if there's somebody is on the electric and has fallen down and something is attached, electric wire is attached to it, then you have to think, will it be safe for me to touch him? So before all this, we have to see first the safety of ourselves. First is your safety, and then you start the resuscitation. This is a main point. First we see the safety. If the person is lying on the road, we have to first see nearby कि ऐसा ना हो कि पीछे से आके गाड़ी ने आप ही को मार दिया. So first you have to see, we have to take that patient just side of the road, and then we have to start doing the resuscitation. And first you have to see the response. What you will ask in first line, are you all right? If there is no response, then tap or squeeze the shoulder and gently. Then again there is no response, then help. Help is there, and anyone around help. Whoever is standing just nearby you, you have to call them and tell them, I need help, because alone you're not able to do it. Then call for emergency medical services. Check for no breathing, no normal breathing. A patient is gasping or not. If gasping without eye opening, you have to see the response. Patient is responding to you or not. Then you manage as a unconscious. This is very important. First, we have seen the safety. Second, we are seeing the response. Main one line is, are you all right? And you have to see, you have to check the response. Then you come to the emergency call. What is the medical emergency medical services call that everybody should remember? That is 112. Because if you don't know what is the emergency medical service call, then you will be keep on thinking. Then with that time, all the minutes and seconds will go. Then you check the pulse. Healthcare provider should take no more than 10 seconds. If no pulse or doubtful, proceed with the chest compression. If there is a children and adult, then go for a carotid. If there is a there, then go for a brachial or femoral. You have to for kids for this you have to use your two finger and the last surface area to feel over the carotid or femoral. This is the third point. First was the safety, second was the response, and third was the emergency call and to feel the pulse. Now come to the CPR. Rescuer should be kneeling or standing by the side of victim in such a manner that the hip of rescuer are above the level of the chest of the victim. Victim should be lying on the firm surface facing upward. If an unresponsive victim is lying face down, then in a prone position, roll the victim to a face-up position that is called supine position. If the victim is not on a firm surface, slip a board under the victim, but it's very difficult. Where is a board? We have board or not. But if the patient has come to you in your emergency, then that board in the your hospital level, that board you can keep with us. If this is not available, possibly shift the victim gentle to the ground. That here in this slide you can see if the patient is on the hard surface and one is all lying on the ground and how the person is sitting, your knees, your hip of the rescuer above the level of the, not above, near the level of the chest of the victim. Now, now it has time to come the CC, that is called chest compression. Victim on the flat surface. Then the very important word is push hard and push fast. You have to push very hard. कोई gentle नहीं चलेगा इसमें कि you are doing very slowly. You have to do the push hard and push fast. Rate should be 100 to 120 compression per minute. First 30 compression in 15 to 18 seconds and it should get compression depth should be 4 to 5 centimeter in adults and half to 1/3 of the chest in the infants. And very important is the landmark. Lower half of the sternum between the nipples in children and adult, just below the nipple line in infants. See, just now they have shown here how to give the chest compression. First, how to make your, first you have to make your fist and where you are giving. Whenever the patient, you get the patient, first you open the button of the patient and try to make comfortable and put your hands and then you start with the chest compression. And just now I have told you for the adults, lower half of the sternum that is between nipples in children and adults and just below nipple line in the infant. Just now it is shown in the figure, the infant chest compression that is half and 1/3. Now, allow complete recoil of the chest after each compression. Minimize interpretation in chest compression. Swap the rescuer every 2 minutes. See, if you keep on doing, then it is very difficult. So many cycles, you won't be able to do it. You'll get tired to avoid the exhaustions. Then if somebody knows, very good. Otherwise, you can tell your nearby, you just see the way you are doing, that you have to follow again another minute. Then yeah, that should be there. Compression should be paused for ventilation till the airway is secured. Ventilation, how you can see the ventilation? See, if the patient head is tilt like that, then you have to, there will be, airway will be blocked. Head tilt, chin left to open the airways, unless if there is some cervical injury suspected and then you rescue the breaths. How you can rescue the breath? Give 2 breaths each hour over 1 second. Sufficient tidal volume to produce visible chest rise. Low minute ventilation can maintain effective oxygenation during CPR. Avoid rapid or forceful breath. Whatever the breath you are giving, you have to see is there any watch for chest rising is there or not. And it won't be that forceful. You have to give very gentle 2 breath after every 30 compression. That I am going to tell next. First, how you rescue the breathing, mouth to mouth breathing. Sometimes you won't be able to do it. Take any paper. Otherwise, you can use any dupatta of yours and one handkerchief, and you can put on the mouth. Then open the victim's airway, pinch the nose, airtight mouth, and give one breath over 1 second. Then take regular, not a deep. Then breathe mouth to barrier device. There are many barrier devices nowadays. And just now, few days back, I have attended one CPR training. They were there. They were providing one small bag and mask. It is you can carry easily in your pocket. At present, I don't have with me that mask. That is very small. Anywhere in your pocket, in your purse, that you can keep. That is a collapsible one, and it is not very costly, and that you can keep everywhere. And ventilation with advanced airway. No pause in compression or ventilation if advanced airway is placed. Providing breath, that is mouth to mouth ventilation. If the victim does not start breathing on opening the airway, the rescuer will have to provide breathe. Keeping in view the desired universal precaution, rescuer should use a barrier device in form of a pocket mask. These are the masks, and I think all learned people are with me. How you use the mask, and whenever you're putting that mask, then it comes like a C shape, and whenever you're holding the chin, it will be like a E, that you can see the fingers, and this is the way you give the breathing. That is very important. And when we keep on learning, when there will be demonstration, then it is very easy to explain it. These are the pocket masks are available in various packing, but most contain a collapsed mask and one wave wall, and there is a pair of gloves and alcohol is available, it's fine. Otherwise, this is a small red color, you can see CPR mask that is available. If you open it, there will be a collapsed mask will be there that you can open it. And this is very important. First cycle you have done, you have given the CPR 30 compression, 1, 2, 3, 4, 5, 6 till 30. Then you give the 2 breath. That is the first cycle for 10 to 18 seconds. Then again the second cycle will come, 30 compression, then 2 breaths. If you have a partner with you, that person can help you in giving the 2 breath. Otherwise, if you're alone, then you have to do everything on your own. Then third cycle, again 2 breath, 30 compression, 2 breath, and the fourth cycle, 30 compression, 2 breath, and the fifth cycle is 30 compression, 2 breaths. So this is the nearly 5 cycle we have to complete. It will take at least 1 minute to complete all this cycle. After this, if we are single rescuer and there is no AED, what is AED that I'll tell later on. Adult appears collapse, ensure the scene safety, then check the responsiveness. This is very important. If it is not responsive, activate emergency medical service, ask for AED. You have to shout. If there is nearby some hospital, something, please bring the AED. If the person is able to get it, fine. Otherwise, you have to learn what is first CPR. That is most important. Assess the breathing and see the carotid pulse for 5 to 10 seconds. No normal breathing or definite pulse. Then you start the chest compression. Then open the airway and give 2 breaths and continue this cycle of 30 compression, 2 breath till the second rescue or AED arrives or there is a sign of life. Remember again, push hard, push fast, allow the complete chest to recoil, minimize interruption in the chest compression. It is not like that you have done only 5, 10 and you are giving the breath. You have to give proper 30 compression, 2 breath, 30 compression, 2 breath. then it will be helpful, and avoid hyperventilation. That is very important. It is CPR is as easy as gap, like compression, push hard and fast on the center of victim chest, then airway till the victim head back and lift the chin to open the airway, then give breathing, give mouth to mouth breathing and rescue. These are called rescue breaths. Early chest compression can immediate circulate the oxygen that is still in the bloodstream, and by changing the sequence, chest compression are initiated sooner and delay in ventilation should be minimal. So this is the thing. The before we used to say airway, breathing, and then compression. Now it is compression, airway, breathing. That that is a very easy way to learn. These are the few in our IME Delhi branch also. We have conducted CPR and we have trained many people. And coming time, we are going to make a already we have started making 3-4 people have joined with us, and we are going to make a team, and that team will be going to help you about the first the CPR. We are not talking about ACLS, that is the acute, and it will be very different. We are just talking about the basic life support, about the CPR, and this is the automated external defibrillator. And for this, I think I thought ki it will take time. So I thought ki it should come in the next meeting, because it has so many things where to place, and this machine, it automatic says first whenever you on, there is a on button will be there. And if you see in uh, airport, you can see now this time whenever you go to the airport and you can see AED machine will be displaying on the walls. And if you ask in the airport, in the flight also, they will be having the AED machine. And nowadays it's available in the what you call metro stations. Metro station also, if you shout and call, ki, please bring AED machine, someone will go and bring that, because it is available. Actually, most of the people, they are not aware ki we have things or not with us. Things are lying with us, and it is always nearby. We have to identify the air, and then only we can go further. Thanks.